Thank you, Kim. Now in our next feature, we look at a new field of diagnostics. Diagnostics are tests that help identify what kind of illness a person has. Some new diagnostics use human saliva, also known as spit. Bell Waring recently caught up with Dr. Lawrence Tabak, Director of the National Institute of Dental and Craniofacial Research, to talk about salivary diagnostics.
Dr. Tabak explained how researchers are creating miniature tests called laboratories on a chip. These measure elements in saliva that include signatures of oral cancer, and although salivary diagnostics are new, the idea of prevention is not.
Dentistry has a long tradition of prevention. Actually, we thought of it long before our medical colleagues did, and we're very proud of that tradition. And in salivary diagnostics, we think we have the promise of taking prevention to a new level, to intercept disease at its earliest inception. And in doing that, it would allow you to have the best possible treatment outcome.
Could you tell us a little about salivary diagnostics and how it works?
The basis of this lies in two separate areas. One is the microelectronic industry, which, as you know, has succeeded in making electronic devices smaller and smaller and smaller. And what that has led to is the ability of microengineers to create things that we refer to as laboratories on a chip. The second area where this has its origins from is so-called point-of-care diagnostics. The idea that you would want to be able to do diagnoses right at the patient's side.
What makes salivary diagnostics different from other tests?
Right, and that first step makes it so very unique because in contrast to blood samples, for example, there's no need for an intermediary. You can do the collection by yourself. You can just simply expectorate in a tube, or you can use sort of a cotton ball and swab your mouth. And then you can put that sample into a preservative mixture. And what that does is it opens up possibilities to provide diagnoses to individuals who heretofore may not have been accessible. It also opens up a spectacular opportunity to do sampling by mail. And there are a number of examples of this. And because of the contents of the saliva, because you can measure so very many different things in it, you can learn a great deal about an individual or populations of individuals by collecting salivary samples and doing the analyses on them.
The labs on a chip now being developed show promise for oral cancer screening.
There is good progress being made in being able to delineate individuals with squamous cell carcinoma. And of course, getting back to the original discussion we had about why salivary diagnostics, because of their ability in prevention. And in oral cancer, of course, the single most important feature is to detect the disease as early as possible. And we think that salivary diagnostics have that potential to really detect the disease at its earliest possible inception.
Elements in saliva reflect elements in the blood, although at different levels. And these elements include not only biomarkers for oral cancer, but also bacteria, viruses, drugs, and hormones. If labs on a chip become routine, salivary diagnostics could be used to monitor health in a new way.
We want to have a test that the individual can do in the privacy of their own home. And so as the bioengineers get more and more clever about their ability to shrink these labs on a chip, it's not too far out of reach to make one of these labs on a chip so small that you can insert it in the mouth so it's there all the time. And so let's say it encounters one of these cells that has an overabundance of a signature for this protein that I spoke about earlier. So now this chip turns purple, and the individual sees the purple chip in their mouth and says, oh, I'd better go to a doctor or a dentist or somebody to have this looked at.
We know that African American men are a very high-risk group for oral cancer. So how can you find and help patients with that kind of problem?
As the intermediary step, which is what you were referring to, yes, we would hope to have devices that could be used inexpensively enough and rapidly enough so that they could be done in community settings or in workplace and so forth. Because one of the large issues within the African American male community is access to care, access to testing on a routine basis. And we would hope that if we could make a test both user-friendly and culturally appropriate and accepting, that we would gain better penetrance into, in this case, the African American male population, which is most at risk for this disease. Because if you can detect that disease very early, the survival rate goes way up. And that's, of course, the key to this whole thing.